Every evening at 7 p.m., New York stops and cheers.
Everyone's clapping.
It's an outpouring of gratitude and support for the heroes on the front lines.
I'm so tired.
For people like Dan Renzi, who came to New York all the way from Kansas City to do his part.
We're here by choice, and we have to get to work, and whatever it takes to get through our day, then we do it.
He's in the middle of working 21 days straight on the overnight shift in a hospital as part of FEMA's response to COVID-19. So far, hundreds of nurses have died from the coronavirus, and studies show in the future, frontline healthcare workers could face anxiety and burnout if they haven't already.
We also have to remember that, as awful as this is, there are also lots of happy, successful stories of patients who check out of the hospital and go home.
For Lauren Yamashita, her team is putting extra thought into who goes into the rooms of COVID-19 patients among high concentrations of the virus and limited PPE.
Actually, in ICU right now, our staff is doubled every day, pretty much. These patients, they become sick so quickly that it's just every little detail we have to be watching for.
For ICU nurses, there's a technical expertise that usually comes with several weeks of training, monitoring machines and numbers like IV lines, ventilators, central line care, catheters, and vital signs. In the time of COVID, it's a crash course.
I have the mark. It's a badge of honor amongst the healthcare workers here. It's from our N95 masks. I have a pressure ulcer on my nose.
There's no time for you to be scared. There's no time for you to feel sorry for yourself. Just find a bag of IV fluids that needs to be replaced and replace them. And look at the numbers that are on the machines. The doctors will tell you, okay, this number has to be this.
And while Renzi says he's seen many patients recover and return home, there's loss happening too.
I'm the guy who gets the people ready to put in the body bags. And, looking at their faces, there's just a finality in it. That what's done is done. And I think that death is not the tragedy. I think the tragedy is losing the fight. And it is much sadder watching the person expire. Once it's done, it's done. And I guess I compartmentalize it.
But for now, these two and hundreds of others keep working hard. For them, a big part of that includes the connection and empathy they say is so key to their job.
I always ask family, is there something you want me to tell them? Because sometimes there's a message and I feel like that would probably bring the family comfort, knowing that the person gets the message, and if the patient can hear, that would give them comfort.
There's respect. And across the board, everywhere I've seen, no matter where I've been in this process, there is a respect for what these people have gone through, and that helps take away some of the sting.
Lindsay Thies, Newsy, Denver.